she'll find. Ain't the moon. If you miss, you'll hit the sky.
Hello, good evening. Welcome to Better Together, sharing our lupus stories. My name is Chanel Gabriel, and we are all the way live and talking about lupus. We are here to empower people living with lupus to live their best lives. So now put some purple hearts in the chat if you are with us as we welcome to the stage, the virtual stage, my co-host, Dr. Michaela Baird, aka the Lupus Doc. Hey.
Hello, Chanel. How are your holidays?
Oh, they were so good. I got to spend time with my family. We went to see the movie Wicked, which was amazing. I recommend. But how was yours?
Also awesome. My sons one of them experienced his first Thanksgiving, so that was special. But lots of family. It was fun.
That's so good. And it also last week was also, and it was great seeing you at the Breaking Through Gala. That was an honor in honor of the Lupus Research Alliance. It was such a good time. It was so good to see you there. Did you have fun?
Yeah, and I connected with a lot of our former guests. So Camila, Shamika, who was just on the show. We actually connected very briefly, but so much energy in the room. It was a fun night.
Yes, and Halsey performed, who also is a famous artist who's living with lupus, and she talked a lot about living with it. But it was such a good time. And if you want to see the pictures, you all get on our Instagram page for Better Together Lupus, because we look so cute. But this is our final episode of this season and this year. We're ending it on a bit of hope, right?
Yes, hope for lupus patients. I mean, that was the theme for the gala. I think this is a theme for the work we do. And our topic is finding hope, finding new lupus treatments.
See, I remember when I was first diagnosed in 2004, and there were no treatments for lupus. It was just taking other drugs that help manage symptoms. And that was just a crazy time.
I know. I mean, I think it's, what people may not see is the years of work that has really gone into understanding lupus, how it works in our body. And I just think it's so exciting, like when we spend time here, coming together for things like the gala, just see how much progress has really been made as we think about lupus and research and just the medical industry and lupus in general.
Yeah, and I think that, it just seems like the medical industry is a lot more interested in learning about lupus. So we are going to talk a little bit more about these opportunities. Also, we're going to talk about the challenges that come about trying to find new treatments for lupus. So we have some great guests. Our first guest is Niobe Gordon-Ricks, who is a lupus advocate and a pharmacy technician living in sunny Arizona, Gilbert, Arizona. And after almost two decades of being misdiagnosed, you now serve as an ambassador for the LFA Lupus Foundation of America in Arizona. And you speak a lot about your community. Hi, Niobe.
Hi, ladies. How are you doing this evening?
We're good. We can't wait to talk to you.
Talk to you.
All right. Yep. So next we have rheumatologist Dr. Cynthia Lawrence Elliott, MD. She is a co-director of the North Georgia Rheumatology Group, along with her sister, Teresa Lawrence Ford, MD. We're going to get her on here next season, I promise. And in addition to seeing patients, you also do a lot of research studies, helping to find new learnings and new things about lupus. And you serve as a board member of the Association of Women in Rheumatology, which we're going to make sure we talk a little bit about. But so glad to have you, Dr. Elliott. Thank you for joining us.
Thank you for inviting me. Good pleasure. Delighted to be here.
Dr. Elliott, so excited to have you here just and talk more about the impact you have been making and continue to make in rheumatology.
Yes. And last but certainly not least, we have Toni Grimes, who is another person representing Arizona. She is the LFA National Support Group Liaison, and you are a professional patient. I love that. You've traveled to Capitol Hill representing lupus patients, served on the education committee in 2014. And you are the constituent engagement liaison for Arizona for the LFA. So that's amazing. And we can't wait to have you share your story, which begins with your service in the military.
Thanks for having me. I'm so excited for this evening.
Yes, yes. This is going to be good.
And we have a great guest on our returning segment, Spotlight on Research. So we'll be talking with Dr. Brittany Gross, whose research contributions have been recognized nationally at conferences. And she runs an investigator site in Napa, California. So she's going to be talking to us about trials and specifically about inclusion and exclusion when we talk about clinical trials. So really looking forward to chatting more about that.
Yes, Dr. Brittany Goss. I'm so excited to have you. And viewers, you are a part of this conversation. Please comment, ask questions in the chat, engage with us and with each other. And while you are here, since this is the end of season 3, and we're hopefully going to go into season 4, there is a link we're going to put in the chat. Please join the conversation and let us know what you would like to hear and hear us talk about next season. Click that link in the chat and feel free to follow up with us. But meanwhile, we are going to get our first guest in. We're so excited to have her here. Please put some purple hearts in that chat as we speak to our first guest, Niobe Gordon-Riggs. Woo! Bring you in. Here we are. Oh no, maybe there's an issue. Hold on. All right. Well, we're going to come back to her because maybe we're, technologically acting up. Okay. But I think that actually maybe we should switch it up. Maybe we're going to switch this up. Is that okay, Dr. Michaela?
Yeah, let's bring in Dr. Elliott.
Okay. So we're going to have Dr. Elliott come in and just kind of talk a little bit more about the experience of bringing bringing treatments to lupus. So let's please welcome to the stage, Dr. Cynthia Lawrence Elliott.
Well, thank you for inviting me. It's always a challenge to engage discussions on lupus because this is such a diverse, complex disease category.
Yeah.
As you know, there's this unique heterogeneity of disease in this complex presentation in patients because of the fluctuating activity and the complexity and even measuring and determining that by just assessing the criteria, it becomes complex at times, especially in our clinical practices. The expertise in different clinicians may vary. And so assessing the response to treatment accurately becomes a challenge even.
No,
and
definitely.
then the need to identify the patients, as I said, there's the established criteria of assessing 4 out of the many complex signs of lupus and symptoms. From some standards, you may see 12 or 11 identifying symptoms and signs. Everybody
I'm so sorry, Dr. Elliott. You said so much good stuff. And I'm like, oh my gosh, she's going away. I have to bring you back. So you're talking about how challenging lupus is.
Yes.
As an illness itself, right?
Yes.
And so just to pull some of the jargon out, because everybody doesn't know what heterogeneity means. I think there's a complex thing. How does lupus differ from other chronic illnesses in that sense when it comes to diagnosis?
Because it's the temporal nature of it. I mean, first of all, everyone doesn't present with the same degree or expression. It can be an evolving, complex conundrum of different symptoms. Some people will come in and they'll say, is this bad? Is it severe? Is it mild? It might be evolving. It might be so early that we're just barely getting the historical aspects of it. The presentations may be skin, one system, rashes, loss of hair, alopecia. purple fingers that occur with stress or cold sensitivity, could be as mild as fatigue, just constitutional symptoms, fatigue, weakness, dizziness, intermittent fevers, 100 or more that last for several days, or even just headaches, which are things that anyone can have, but these are different headaches. They're just intractable. They don't go away. They're horrible. And so the symptoms may vary, but migrate through different specialists and never get to the rheumatologist in time to put it together, because it's always a puzzle to put these pieces together. I've heard the term, you have to have a gestalt, to put this together sometimes, the rheuma gestalt, Dr. Michaela, you've heard that. And
yes, I mean, you speak so well on how nuanced and how, difficult it can be. And I think the patients who come on this always speak well for how, difficult it can be to express some of the symptoms or really share those with their physicians.
Yes.
How do you think research is impacting that? Because you do a lot of work with different research trials and have seen a lot of research trials throughout the years. Like, do you think we're doing a better job?
We're doing a much better job in assessing the variability of disease activity, because we're looking at all the criteria that's presented. I mean, we've got so many different domains and systems to attack. We've got to be very precise in identifying the systemic varieties of presentation. But we could do a lot better with recruitment, because in order to get accurate assessments and things that are clinically reproducible, we try to get homogeneous populations in the classical research studies. And that's just not going to happen in the case of systemic lupus unless we do a lot of more expertise in our clinical recruitment. We need to get broader based recruitment panels. We need to expand our pool of patients, and they need to be inclusive of very diverse populations. And we need to get more of the underserved, because as it stands now, the presentations are, as I said, variable, but we don't have enough of the treatment availability for those in the underserved population. If you do have an identified patient population, how are you going to get the treatment to them if they can't afford it, if they have inaccess to get to the treatment sites? We have to understand those needs too. The studies require long durations of treatment. So first you have to have the patient understand the disease. So the education of the patient, and exposing them to the capricious nature of the disease, the long duration of the disease, chronicity, and the multiplicity of systemic effects, from the mild or evolving presentations, possibly skin or mucosal membranes, which are superficial, to the deeper, more severe expressions of serositis in the lung, the heart. I mean, the inflammation is quite complex and diffuse, can affect any system. We hear of the kidney, but we often don't hear of the pancreas or the gut manifestations. And it's my unique, experience in many cases to witness neurological manifestations that may be very subtle.
Yeah, no, thank you so
Small
much
fiber neuropathy, the paresthesias, the burning sensations. And how often do you get an early lupus patient with mild neurological presentations? Not often. So
no, thank you.
Look at those domains.
You're saying some really, really great, important facts. So I'm just to recap everything that you shared. You talked about how important it is to be a part of clinical trials as a person with lupus, just for us to even fully understand lupus even better, because of how much these the manifestations, as you say, the way that lupus shows up, in different bodies, and how it can. I never thought about the pancreas, although I definitely have had the purple fingers, and people out there might be like, purple fingers, it's called Raynaud's. And so
Raynaud's, yes, phenomenon.
Yeah. I'm just letting I know, Just making sure the people that are watching know like what all of these things are. And because we do get quite a few people that are learning about lupus
Right.
through this show. But yeah, definitely making sure that we have that. But also you talked about like this access to care, which is so
Yes.
important, because
So
if you don't
important,
have quality
yes.
care, you're definitely not going to enroll in a clinical trial. You don't even have a regular doctor. So understanding how important it is to recognize the
Oh, yes.
underserved, meaning the communities that don't have access to quality health care. That's really
And so,
important.
yes. So many get lost in the system, and especially as I was thinking about the different systems, a neurological system again, strokes and TIAs often go so far away from the rheumatologist that we don't see them till way later, oftentimes. But I think with better information systems and the analyses now, the hematologists get them to us earlier, those with anemia and the loss of platelets, the clotting factors, and the miscarriages, they get to us earlier now, I think, because the good thing is that the multi-specialists are being informed earlier, and in training panels, we're getting a lot of exposure now to lupus patients, I think. So I think it's the clinical expertise is the one thing, and recruitment are the two major things that need better upgrading, I think, because we know that it's going to be hard to recruit, and then retention is my next major complaint or observation about problems in research. Retention, patient retention, and it has to be based on trust. So, that's
we got to get patients in. We got to get patients in. We really do. And I think, thank you so much for the work you do, because not only do you do research, but you still see patients. And I know that they are so lucky to have you. And this is so important. So we're going to bring you back to have some more conversation with us. But we're going to bring in a lupus warrior that can kind of speak to their own experience in managing their lupus, as well as clinical trials as well. So thank you so much, Dr. Elliott. We're going to bring you back and welcome everyone. Please put some purple hearts in the chat as we bring to the stage Niobe Gordon-Ricks.
Welcome, Niobe. We're so happy you're here with us and you're able to navigate whatever kept you initially. So you're here now. And we want to hear about your lupus story. Share with us.
So my onset of symptoms started when I was 12. And we weren't really sure what was going on. I had a lot of different things going on. I went to my pediatrician. They thought I had anemia, so it was bad. But
Niobe, really quickly, if you could speak up just a little bit louder. We're having a little bit of glitching, but I can't hear you as clearly. So please repeat what you just said.
Better now?
Yes, a little bit better. Thank you.
Like I was saying, my symptoms started at 12. I went to the doctor. They thought that it was anemia. And so they were treating me for that. But my symptoms started increasing in different areas. And I was having difficulty with walking. I had a partial paralysis. And they really weren't sure what was going on with me. Being a teenager, they think that it's, puberty, it's going through the change of life, these things happen, it'll go away. But the symptoms never went away. And every time I went to the doctor, I was discarded, I was ignored. They didn't check about my family history, they didn't do very much testing on me at all. Long story short, it took about 19 years and 8 doctors before I got my diagnosis for lupus.
Wow.
Yeah.
And
I went through quite a few misdiagnoses.
And I think that that's something that to what Dr. Elliott said is really important. This is access to care and quality care, and where people are able to listen to doctors. Listen to patients, but doctors listen to patients. And I feel like sometimes as women, they do that thing where they go, it's your hormones.
I think the biggest issue is that when the onset of symptoms start when you're a preteen, they automatically think that you're not puberty. And as a child, you don't really know how to advocate for yourself. So it's up to your parents to advocate for you. And if they're not educated, then they don't know how to advocate for you. And I think that was the issue when it came to my diagnosis.
Yeah, I agree with you, Niobe. And I think that's why, you know, this show exists, but also we need to talk in our communities with each other about our diagnoses and share with friends and family about what that looks like, so maybe people can be more aware. And I know that's something you're doing. Um, but we want to know a little bit about your experience, because I think you've been in a clinical trial.
I have.
So tell us about that.
It's really funny because when I relocated here from New York, the first thing one of the doctors did is ask me if I was interested in doing a clinical trial. And I looked at her like she was crazy. I was like, they haven't been really good to Black people. I don't know a lot about clinical trials. I don't know if it's something that's for me. We had to do a lot of discussing. I had to speak with my family about it. It took about 6 months before she really convinced me to go ahead and participate. And I really am so glad that I did.
So what was the turning point? Like, what made you say, okay, I'm ready to do it?
The information that I got from the researchers was a big influence on me participating. Knowing that they didn't have a large demographic that looked like me, who are, you know, the most affected by lupus. So they didn't have enough data on African American females and how these new medications could, you know, help them with the treatment of their lupus. So that was really the turning point for me. I was like, somebody has to start. Somebody has to, you know, participate. So I was more than happy to be one of those participants.
And I know you say you were like, you know, the first thing you said was no. And I've been a part of clinical trials, and that was the first thing I said as well. So yeah. I totally know, like, you're not going to do that. I'm a Black woman in America, you know, like
exactly.
Like, no. And but I'm curious, and I know, and I think it's really cool that you got to speak to the researcher. And I don't think people think that they can ask questions. It's just like, because I didn't feel that way at first. Like I'd said no and didn't do one, and then jumped in one later. So the fact that you like said, hey, I want to speak to a researcher, I want to speak to more and learn more, was definitely significant. So I'm curious, did you have any challenges staying in the trial? Like, you know, what was, without going through too much detail, what was a trial like?
It was a blind trial. So you either get the drug or you get a placebo. So I really didn't know what I was getting. I just knew that I showed up every month and I participated. I asked questions, they asked me questions. The thing is, I didn't have any issues staying in the trial because I was always able to speak to the people that were running the trial. They were always present whenever I had my infusion. If I had any questions or any concerns, they were always there to answer them. So I really didn't feel that I was alone in doing this. I didn't feel that I was like a guinea pig and they just used me as a number or a piece of data. I felt like they really cared about my participation and, you know, how it would affect me.
Mm-hmm. That's good to hear. That's good to hear.
So, Niobe, as a patient, you know, what's your advice for people considering clinical trials?
I think that information is power. I think you need to know as much information about the trial, about whatever medications you're going to be using. If there are going to be any side effects, I think that you have to journal and keep a journal. Write down all the questions that you want to ask. Find out what it is that you know, what about you makes you qualified to participate. Just ask as many questions as possible.
No, that's so good. I think that part of asking questions, advocate, self-advocacy comes up in almost every episode we have. And I mean, I think you definitely have shown how much you've advocated, even in diagnosis, the idea that like for 19 years, you kept following up with doctors, while a lot of people would just say, forget it, I'll see what happens. You know, you consistently advocated, and this ended up becoming another part of your advocacy. So we connected to you through our other guest who's going to be coming on, Tony. I'm just curious, how did you both meet?
I met Tony when I moved out here. We were at a pre-lupus walk event, and you know, we just introduced ourselves to each other and, you know, shared our lupus story, and she's been my sister since. So for about 12 years now.
Oh, that's so great. That's so great. Well, I'm really excited. Thank you so much for you sharing your story. And I think clinical trials, having somebody that one just kind of talked a little bit about the experience, because I think people think clinical trials are I'm in this like locked room and it's cold and it's dark and I'm in a basement. And people think of things like that.
Definitely was not that. It was nice and comfortable. They gave me snacks and everything, so it was great.
Snacks are great.
They are great.
Snacks are great. Well, I really appreciate you being able to jump in and join us. We're gonna go on to the next guest. We're gonna bring you back. Don't worry, we're gonna bring you back and have you have some conversation with us. But I'm very excited, and I think it's important that we know representation matters, especially with an illness that affects it's 95% women it affects, right, Dr. Michaela?
Yeah, it's high, like 9 out of 10 women. Yeah.
Yeah, definitely. And, it's so important that we hear these stories from people that look like us that can really speak to our experience. So, but our next guest went from serving our country in one way to supporting lupus patients across the country through her work with the LFA. So please put some hearts in the chat as we welcome to the virtual stage, Toni Grimes.
Hello again, ladies.
Hi. Toni, thank you for joining us this evening. And you're on Mountain Time this afternoon, are we right?
Yes, yes.
You are also our 2023 Sandra C. Raymond Advocate of the Year. Is that true?
Yes, yes. It was definitely a shock. I had no clue because all I want to do is support other lupus warriors and advocate and have a voice for those who no longer have a voice.
Mhm. Well, thank you for joining us from where you are and sharing that. We want to hear about this voice that you're using and to hear your lupus story.
Well, I was diagnosed in 2007, and unlike Niobe, my diagnosis was really quick.
Hmm.
At the time, I was serving as an Army officer, and I was getting ready to deploy to Iraq. And while I was training, I noticed that I was having a hard time breathing. So I went and got a chest X-ray, and they said I had fluid around my lung, which is normal for people. And they sent me off to go get to see a pulmonologist who did a thoracentesis to draw the fluid and test it. So he said, come back in a month for a follow-up and we'll see you then, but it's normal, it's not a big deal. So I just kind of went on with my business, did my follow-up, and he took me straight from his office to a rheumatology department. And he's like, we got to get you in right now because I was getting ready to leave for another military school in 2 weeks. And so the doctor put in rush order of labs. I had 17 vials of blood drawn. I remember asking the phlebotomist, like, what are these labs? Because I was always a healthy person. And to me, it just looked like a whole bunch of alphabet soup with all the different labs I was getting. So I went back, waited. I met with the rheumatologist right then and there. All the tests came back saying that I had lupus. So I was diagnosed in a month. And that's only because that's how long my follow-up appointment was. And so I didn't deploy to Iraq because my lung collapsed. So basically, the fluid tested positive for anti-nuclear antibody. And so when we tried to drain the fluid again, it collapsed. And so I'd had surgery the day my unit deployed. So I ended up deploying later. And during that time, I was having problems with my lower left flank pain. And I didn't know what it was. Well, fast forward, I got medevac back to the US, both for mental health issues and then also for that pain. And I actually was in the early stages of kidney failure while I was in Afghanistan. So that's where that went. And then eventually I ended up having neuropsychiatric lupus and psychosis with my PTSD. And so that ultimately ended my military career. So I ended up retiring with just over 19 years. And so I took off the uniform and put on a cape to help other lupus warriors.
Oh no, but we have to jump over. I can't jump over that. That's such I can only imagine you're living your life for this career and you're doing so much to have this career and for lupus to really impact that. And also like not to overlook, like you were hospitalized for 6 months to
Yes.
relearn how to walk, talk, and write because of What got you through those challenging days? That sounds really, really tough, and I'm sure that people need to hear that hope and encouragement that you were able to make it through that.
I would say first it was really my mom. Because when I got diagnosed, it was just a phone call. My mom lives in Phoenix, and I said, "Hey, I have the thing lupus," and it was like, "Oh, okay." And we just went to the next conversation because I'm the only one in my family with it. And so when she got the call, she flew out to Texas, and she was with me the whole time. And she had to learn. I swear, she ended up getting a PhD in lupus. And my mom, she was in her early 60s and not very computer savvy, but every time the doctors would give me another medication, do another test, she would go back to her room and Google it to find out what it was, and she would go back and advocate for me. So she really fought for me a lot to make sure I got the right care and that I was getting the treatment that I needed.
No.
Thank you for sharing that. I'm so glad you had that support in your mothers. That makes such a big difference, as we talk about all the time on this show, the support system. As we talk about clinical trials and therapy-based clinical trials, I don't think you've been in one, but you've supported research in so many ways. Tell us more about that.
Yeah, so I've been involved in a global research program that brings pharma, patients, and international lupus experts together. And so, what we're working on right now is developing new outcome measures for FLE clinical trials. So it's been an amazing experience because our primary investigator is out of Australia, and we're working with people from Lupus Europe and from people all over the world. And it's just great to see that we're coming together for one common cause so that we can have better outcome measures so that our clinical trials can be more successful and we can find new and better treatments.
No, thank you for clarifying that, because I think everyone thinks that the only way you can support research is through clinical trial, through being a part of one, but even supporting that is amazing. And patient-reported outcomes. Dr. Michaela, can you just explain what that is really quickly? Because I don't want to make sure everyone understands what PROs are.
Yeah, I mean, so, when we're trying to assess how active someone's symptoms are, we actually can rely on the patient's own ratings, their own assessments of, for example, joint pain or rash. So, asking the patient in their themselves and not the physician to really give their own ratings and interpretations of how active their symptoms are.
Good. So it's kind of like not necessarily a checklist, but just a list of things that say, okay, fatigue, how fatigued were you? Just being able to have patients have clear understandings to give the doctor a clear understanding of their activity of their disease.
Yeah, because we know that the patients know better than anyone how active their symptoms are.
Yeah, no, it sounds like you're doing great work over there, Tony. And I know that you support, but I just want to clarify really quickly. Have you been a part of any studies? Because I think sometimes we only think of like, I got this medication, but I feel like you've been a part of a study as
I've
well.
been part of some observational studies, where they're looking at people with lupus and different things, particularly when it came to some of the COVID vaccines and things of those natures. And then also I have some other observational studies I've been doing since I was in college. So it's been great to see, especially that one, because at the time, I didn't know. I just signed up. They were in our student union. They asked us. And, now here it is, decades later that I'm seeing information that they put out every so often that's, tracking us and showing like, hey, we've noticed that we're seeing more women with lupus, over the years when they're getting diagnosed or have higher levels of, cholesterol or diabetes, so it's great to be part of that. And at the time, like I said, I was a college student. I didn't know, but it's great to, be part of research in any way that you can.
Tony, you use this word observational studies. What has that meant for you? And maybe you could share with our viewers a little bit more about that.
Well, for the one observational study I was doing, I had to go in and do lab work every so often, and then they would send me questionnaires via email that I would answer. So we had it done like on a certain time scale. So like before I had gotten like the COVID vaccine, they had me do some pre-labs and then a questionnaire, and then it was like 2 weeks after. 4 weeks after, then 3, 6, 9, 10, 12 months later, they just
Mhm.
wanted to see how I was.
So you were being monitored essentially, but you weren't receiving a treatment or a placebo medication.
That's correct. That's correct.
Great. So I know you've also done a lot of work with many different organizations. So tell us a little bit about how that work with organizations really impacts research.
Well, the one that I'm really proud to be part of is the Department of Defense Lupus Research Program. And so in 2017, they actually started doing their own research outside of NIH. And so I was able to be a consumer reviewer on a peer review panel. And it was an amazing event because, you know, I got to sit down with researchers and clinicians, and we got to look at grant proposals. And so right now, the DoD is giving $10 million for research for high risk, high payoff research that's not being done anywhere else. And so it's great to see as a patient, one, to have a voice and to be at the table and to be able to have our input. Because, you know, a lot of times we'll get medications and we'll have side effects. Well, I'm able to have a voice to say, you know, maybe this side effect might not be a high priority for us, that we really want this drug, or maybe this is something we need to look at, you know, and reevaluate. So it's been great to be able to be part of that, and just see some of the research actually come to fruition. So that's been amazing.
So I didn't even know that there is this whole other thing. The Department of Defense is working on treatments. That's you said DOD. I was like, wait, everybody's like, wait, that's Department of Defense?
Yeah, because they actually see a higher prevalence of people in the military being diagnosed with lupus. And when I got diagnosed, I didn't know anybody, but after I got out of service, a lot of people were getting diagnosed and being medically retired, like myself. And I still had service members that were still calling me saying, "Hey, I have a soldier that just got diagnosed. Can you speak with them?"
Wow. Well, I just want to say thank you for the work that you are doing. It is so important. And it's like we have Niobe who's done clinical trials and been a part of the treatment side, but you're doing so much work for, you know, in another way, the studies, the observational opportunities that are there. I don't think that's something everyone considers as part of research. So, and also being on a panel to help that. Well, you're doing some great work, and we're really glad to have you. So we're going to bring you back, but we're going to move on to our special segment. Thank you so much, Tony. We'll talk to you in a second. But we're going to move on to our special segment on Better Together, which is called Spotlight on Research.
So this segment invites guests from research sites around the country, and it's really to better explain the journey that leads to new treatments, because Chanel and I keep talking about, you know, this research process. So that's what we're going to be doing.
Yep. And today we are going to be focusing on patient safety, but more specifically, inclusion and exclusion criteria. So we have Dr. Brittany Goss. She is a distinguished rheumatologist with over a decade of experience in both patient practice, research, and academic medicine. Dr. Goss is also an assistant professor of medicine and rheumatology at Des Moines University Medical School. And she's an adjunct assistant professor of rheumatology at Touro University Medical School. So she's an investigator in Napa Valley, California. Welcome to the virtual stage, Dr. Goss.
Hi, thanks for having me.
Hi, Dr. Goss. Thank you for taking the time to join us. So many people think that they have to be a part of a clinical trial, and you just have to sign up. So to be a part, you put your name in and sign up, and, you know, everyone is taken. But is that true? Does everyone get into a clinical trial that signs up?
It's not quite like that. You know, we talk to everybody who calls and wants to participate, but we usually have a list of special questions or things that we go through with the patients on the phone to see if they would even be potentially included in the trials. So we tend to go through those screening questions over the phone with the patients before we even start to consider seeing them.
So there's so many, you use the word, inclusion, and we know it comes out in a lot of different ways in our world today, right? But it's a little different in this case. So can you please describe and define inclusion and exclusion criteria just for us so we understand that?
So inclusion criteria in the study setting, they're different for every single study that we look at. But for us, what it means are there things that we want the patients to have when we're seeing them. So it might be their particular kind of lupus. Say maybe we want them to be within a certain age range, or that we want them to maybe have a certain amount of skin disease or oral ulcers. Maybe we want them to have a little bit of kidney disease. They have to have a certain focus of things. So we want them to be sick, but maybe not too sick when they come in. A lot of times that's the thing that we want. But when we look at the exclusion criteria, those are the things that we say that the patient cannot have. They might not be eligible for the study. And those are things where we say maybe the patient can't have too severe of kidney disease, or maybe uncontrolled things like uncontrolled diabetes or uncontrolled blood pressure.
And I've definitely been a part of that, because I tried to get into a clinical trial recently, and they were like, "Oh no, you're too well. Can you reach out when you're a little more sick?" Which is so frustrating.
Yes.
But what do you think someone like me, someone who tries to get into a clinical trial and hears no, what should we do after that? I mean, is it over?
Yeah, I would never give up on it. A lot of times too, if they forget to tell you, when they say, well, you're not sick enough yet, a lot of times there's a window too, where we say, hey, but if you flare, give us a call and we can re-screen you. So when people do call in and say, well, here's what's going on right now, and we talk to them, but they don't have enough active disease maybe at the moment, we tell them, just call us when you flare. And we have like a watch period for the start of the study or when we can screen.
Perfect.
Thank you. So our lupus guests here aren't the only ones with a story, and I hear there's a personal reason why you did decide to get into research, Dr. Goss. Can you share with us?
There's quite a few reasons, actually. I mean, part of it is that, I had always wanted to get into research, but never had the time. And the opportunity did come up for me to be able to do it at a time when I was going to be taking a break from my practice, which was perfect. And it allowed me a lot more time to spend with my family, which they really needed it too, with my kids. So it was perfect for me. And I'm just enjoying being able to provide care to patients without having to worry about the hassle with insurance too. So it's been a wonderful fit for me, and being a part of developing drugs and seeing people get better, and just being a part of all of that. It's huge.
Yeah, well, I can relate to it so much, but I think Chanel has one more question.
I was going to say, she said something in there. She says, not having to deal with insurance.
Yeah.
Because a lot of people might not know this part.
Okay. Yeah. When we're doing clinical trials, insurance is no longer a part of anything. So you don't have to worry about getting an insurance authorization or worrying about if you're going to be covered by your plan to come in for a screening. Many times you just call. And so we don't have to worry about getting anything authorized. Your care is your care, no matter what. It's all taken care of. And so it's just a beautiful thing, because it's just pure patient care, and it just feels like the way it's supposed to be. So it's very nice. It just brings it back down to the patient provider type of care the way it's meant to be, I think, in a way where you can provide that quality care and a long visit, whatever you need. So it's really nice.
And I think that's such an important point that, people don't know or hear about being a part of a research study. And I think that builds well on what Dr. Lawrence Elliott was sharing with us about how important it is to build access in this space. So I think that this is a great space where we can talk more and think more about how patients access great care. So
yeah, absolutely.
Thank you so much, Dr. Goss, for your work and just for joining us today for the Spotlight on Research segment.
Thank you for having me.
Yes, now let's welcome everybody back, because I think this is a rich group of people that have so many perspectives around this. So let's bring all of our guests back to the stage. Dr. Elliott, Tony, Niobe. Yes, I think it's so interesting to see these different perspectives around how we can get access to quality care, as well as get access to new treatments, as well as make an impact on just the world of medicine as a patient and as a doctor.
So true.
Yeah, it's great.
So we've been talking about inclusion, exclusion, and Dr. Goss did such an excellent job explaining this. Dr. Elliott, would you comment a little bit on inclusion, exclusion criteria, and if this makes it helpful or more challenging as you're signing patients up?
It definitely makes it more challenging because oftentimes the inclusivity is well taken, but it's well accountable. But the exclusions are sometimes a little more tricky and difficult to navigate. So as Dr. Goss said, it's pretty cut and dry, but it does limit us more on the exclusion side. And I might want to add that, I don't know if this is appropriate, but I just want to put this context in play, that for me, the ethical considerations of the drug are major. And I think it's really very much needed that we balance the need for the efficacy, for treatment, and the potential risks associated with the new measures or medications that are being recommended. So I think it takes a very careful consideration of all the factors, the ins and outs.
Yeah,
and
I think
of course, that
speaks
compassion for the patient.
Right, what you were saying earlier, that bond, that trust that clearly Dr. Goss has with her patients, you have with your patients, so that there's already that discussion happening about what are the concerns and benefits.
Yes.
No, definitely. I think the inclusion exclusion criteria, and that's the thing that makes it so frustrating sometimes when you're like, oh, hey, I'm ready to be a part of this. But as you talked about earlier, that lupus manifests so many different ways within the body that sometimes a trial is only looking for people that have this kind of activity or don't have this kind of activity. And I know for me, some of the things that I have around my lupus has prevented me from being a part of trial. I'm not supposed to know that because they don't really tell you. So you don't try to call back and pretend you don't have the symptom that they said. But definitely, those things can be really tricky. So I'm just curious. I think this is something that everybody can maybe contribute to. Maybe Niobe, if you'd like to share, and Tony, what tips do you have for somebody who thinks that a therapy might not be working for them? Feel free to bring clinical trials into that. But just in general, I think that we're talking about new treatments and hope. If something is not working for me, what advice do you have? And maybe how do they have that conversation with their doctor? Niobe, you want to start? Tony, you could start. Go ahead.
Well, I think, first of all, a patient doctor relationship is an intimate relationship. As a patient, we have to be able to tell our doctors anything. And so I always say that as patients, we provide puzzle pieces to the doctors. And if we don't give them all the pieces, they can't make the proper diagnosis and treatment plan. So when you feel that you're not getting better, or you don't feel that treatment, that you're becoming a non-responder, that's when you got to have that conversation. But I think by having a good um, a good relationship with your provider makes it so much easier to have those conversations.
Thank you. Thank you. Niobe, what are your thoughts?
I agree with Tony. I think that the relationship between the patient and the doctor is super important.
I'm
And if
so
you
sorry.
find,
Can you
I,
speak up just a little bit more, Niobe? Just speak
I
up a little
think
bit.
that I think that the patient relationship between a doctor and is important. I think that you have to be comfortable asking your doctor questions. I think that you have to advocate for yourself if you feel you're not being heard. One thing I tell people all the time is don't be afraid to fire the doctor, because if they're not listening to you, then they don't care about your well-being. And you have to be with someone who cares about your well-being. You're coming to them for a reason. So, have your questions. If you have side effects, let them know what those side effects are. Let them know how long they last. Let them know what they're doing to you. Make sure that you're being heard. And again, if you're not being heard, fire your doctor and get a new one.
Said fire. She said that was one of the. I was about to quote somebody that I don't know if everybody loves right now. Fired, but yeah, recognizing that as a patient, you have the power and you are able to say, "Hey, this is not working for me," and if this doesn't work for me, I'm gonna go over there. is really important, because I don't think we always feel that way, especially as for doctors who have all these years of experience in medicine and these wonderful titles. Sometimes it's really hard for people to say, "Hey, I'm going to talk up over you or against you at all." That's really challenging. I'm going to go to, how about this, Dr. Goss? I'm curious. I know you've had experience as far as patients. What do you think it should happen, in a case where a patient that thinks that therapy is not helping for them? What do you think are options for them?
So, we always talk about if something's not working for them, because, we always go over symptoms and how they're doing when they come in. If something's not working, we try to figure out why. If there's still disease activity, make sure they're taking the medication properly. And if those things are all going the way they're supposed to and the medication's still not working, then we start talking about other medication options. If for some reason, it's not a good fit or we need extra help, of course, you can always get that second opinion too. Sometimes you need help with lupus patients. Sometimes there are more things going on where you do need that added second look to see what you're missing too. And so you should never be afraid to say like, "Hey, I need a second set of eyes," especially with lupus. I think that that's always a wise choice. If somebody's not getting better despite all of your best efforts.
Mm-hmm.
Mm-hmm. And close us out, Doctor. Oh, actually, no, I'm going to ask. I like to ask Dr. Michaela. I pull her in too. But Dr. Elliott, what are your thoughts? What are the options if a patient says, "I feel like this is not working"? What are the options they should have? And maybe how do they have that conversation with their doctor if they're a little nervous?
Well, I agree. I agree with the tenet of basic trust and transparency, and to always keep that the communication open, and the line of communication open. Most of my patients will have my cell number. I let them feel comfortable with calling and talking to me, and I personalize our relationship with knowing their care, if they are caregivers or if they have caretakers. I get to know all their support systems. And it's very important to know the needs and understand the needs of the patients, especially in an underserved population. We gauge a lot of our recruitment on access to the treatment sites. So transportation needs, work allowances, all of the things that they need have to be addressed. So I think taking into consideration the full scope of the individual, and that's it, taking each patient as an individual, I think goes a long way.
Yeah, I could have said it better. And clearly, the patients you're working with, both of you, Dr. Goss and Dr. Lawrence Elliott, are very lucky. And so interesting, we're hearing this idea of, switching doctors. And I think that, people should know as well that providers, don't want you to have the best relationship with your doctor. And we
Right.
often know that sometimes that means finding someone else. If
Yeah.
you have a preference, maybe you want to work with a person of a different race or ethnicity or background, that happens, and we get that. So I think it's really important to hear that on both ends, that we're both all supportive of that.
Yeah.
Definitely, definitely. And I mean, I feel for me as a patient, I am, I think Niobe mentioned in the beginning, like being armed with knowledge, like having knowledge was really important. Was that you, Niobe, or am I missed? I believe it was you talking about, knowledge is our power. And I think sometimes as a patient, we leave all the knowledge to the doctor. And I think it's very important for me. I always say this, I am a geek when it comes to lupus. Okay. I can get all the jargon, all the doctor little fancy words. I know what they are. And but a part of that is just so that I'm never in the dark. And so I think it's really, really important for me to know, and for patients to know, like, keep up to what's going on in the field and going on with their illness. I think that that's important. So that's just me. Take the time to really try to understand.
This has been Dynamic Conversation. Thank you to all of you who shared your time tonight. Of course, thank you, our viewers watching in real time and later, and everyone who has been joining us this season. We're so excited to continue to share this space.
No, definitely, definitely. And I know I'm hopeful for better treatments. I'm hopeful for a cure. And all of you are doing this great work. So once again, thank you, Tony, Niobe, Dr. Lawrence Elliott, Dr. Goss, for your time, your wisdom. The more we learn about lupus, the more hope we can have for a world without lupus. I appreciate you all.
Thank you for having me.
Great. Oh, the end of season 3.
I can't believe it.
But yeah, so we also want to thank our viewers for joining us this season. But Lord willing, we'll be back in 2025. And we're sending a special thank you to Biogen for making this show possible. If anyone is interested in getting any more information about lupus or want to get information on participating in clinical trials, you can use the camera on your phone to scan this QR code right here. Or you can go to biogentriallink.com. So take a look right here.
And if you're interested in a specific lupus clinical study, take a second to scan any one of these QR codes that you can see on the screen to learn more. We'll be sharing them again at the end of the show in case you missed them. And you can also see the chat for a direct link.
Awesome. So we're gone, but not gone too long. And thank you so much to all of those that joined us. I see you, EP Lawrence. Thank you for chiming in. Katrina Parker, Sharifa Purple Passion. We're gone, but not too long. Until then, you can find us on all the social medias. Join us on Instagram at For Better Together Lupus, and also on Facebook at Better Together Lupus. You can check out past episodes at bettertogetherlupus.com. All of the links are there. And don't forget to let us know what you want to talk about, okay? We have a form that we're going to put in the chat that lets us think about what should we talk about next season.
And now, as always, to close our final show and our season, let's hear some spoken word from Chanel.
This is not the end. This is the new beginning. One where we believe miracles can happen, that we can find new purpose, discover unseen passions. It takes sweat. It takes dedication. It takes uncomfortable conversations to change the trajectory, the state of what is versus what could be. I believe in mankind's wisdom. I believe a cure is possible. I know that if I just give a little time, a little faith, a little trust, something new and beautiful can possibly bloom. Thank you so much, everyone. I look forward to seeing you all next season and seeing you on Instagram. Have a good night.